All right, let's dive into something that impacts pretty much all of us, even though we might not see it. Healthcare IT integration. Now, I know, it sounds super technical, right? But trust me, it's the secret sauce that makes your hospital visit smoother, safer, and a whole lot faster.
You know exactly what I'm talking about, don't you? You tell your whole story at the registration desk, then you say it all again to the nurse, and just when you think you're done, you repeat it again for the doctor. It's so frustrating. But what if I told you that's not just a minor annoyance? It's actually a huge red flag pointing to a much bigger problem.
And that problem? Well, we're going to call it the hospital data headache. This is what happens when all the different parts of a hospital, the lab, the pharmacy, the billing office, are all using their own separate computer systems that, you guessed it, don't talk to each other. It creates total digital chaos for everyone.
And you can feel the effects of this chaos. You know, when a crucial lab result is ready, but your doctor can't see it because it's trapped in another system, or maybe your name is spelled one way at registration and another way at the pharmacy, which leads to all sorts of billing nightmares. Your prescription gets delayed. Meanwhile, the staff are stuck typing in the same information over and over and over again. These aren't just little hiccups. They're signs of a broken, disconnected system that can cause serious delays and even medical errors. So, what's the cure for this massive headache? It's actually a pretty simple but really powerful idea: integration. It's all about connecting those dots and making every single part of the hospital work together like a well-oiled machine.
So what is healthcare IT integration at its core? It's the process of getting all those separate systems, from the front desk to the lab to your doctor's screen, to finally talk to each other. So instead of these isolated islands of information, you get one seamless, smooth digital flow. This is how we turn all that chaos into coordination.
So to really get a feel for how this works in the real world, let's follow the data. We're going to go on a patient's journey through a hospital that's fully connected, from the second they walk in the door to the moment they check out.
Okay, so let's trace the path your information takes. It all starts at registration, right? Then it moves on to your consultation with the doctor. From there, it goes to any lab or imaging tests, then circles back for the results review, heads over to the pharmacy, and finally lands at billing. In a truly integrated hospital, your data just flows effortlessly through every one of these steps, showing up exactly where it needs to be, right when it's needed.
And the heart of it all is the electronic health record, or the EHR. Just think of this as your digital master file. The moment you register, all your info goes right in here. Every diagnosis, every allergy, every medication, it's all kept in this one central place. And what does that mean for you? No more repeating your story.
Okay, so your doctor orders a blood test or maybe an X-ray. In a connected system, that order zips electronically over to the specialized systems for the lab and radiology departments. But here's the real magic. As soon as those results are ready, they flow right back into your EHR, automatically. No more waiting for someone to make a phone call or deliver a piece of paper. It's just there.
And it's the exact same story for your prescriptions. The doctor's order goes straight from your EHR and pops up directly in the pharmacy system. This isn't just about cutting down your wait time, which is great. It also massively reduces the chance of errors from someone misreading handwriting. It's just so much faster and safer.
So we get what integration does, but how do all these different systems actually communicate with each other? Well, it all comes down to some really clever technology that plays the role of both a universal translator and a digital traffic cop. You see, different systems often speak different digital languages. For decades, the main language was a standard called HL7. You can think of it like sending a really structured digital fax. It gets the job done, but it's pretty old school and rigid. The new, modern standard is called FHIR. That's FHIR. It's way more flexible. Think about how a modern app on your phone can just instantly pull data from the web. That's FHIR. It's what makes it so much easier to connect hospital data to things like patient portals and mobile health apps.
So how in the world do you get a hospital's jumble of old and new systems, all speaking these different languages, to work together? That's where these unsung heroes called middleware and interface engines come in. They are the true translators and traffic controllers working behind the scenes. They grab data from one system, convert it into a language another system can understand, and send it on its way. They're what finally brings order to all that digital chaos. Of course, with all this personal health data flying between systems, we absolutely have to talk about something that is non-negotiable: security. Keeping sensitive patient information safe isn't just a feature, it is the #1 priority.
And that security rests on a few key pillars. You've got encryption, which scrambles the data so no one can read it.
There's authentication to prove you are who you say you are. Then there's access control, which is so important. This makes sure people only see the information they need to do their job. So, for example, your pharmacist needs to see your prescriptions, but they have no business looking at your x-rays. And finally, audit trails track who looked at what and when, creating a full record of every action.
And honestly, this really gets to the heart of the whole matter. The technology is amazing, but it has to be built on a rock-solid foundation of safety and patient trust. The whole point is to make healthcare better, not to put anyone's privacy at risk.
Which brings us right back to the ultimate goal of all of this tech. It isn't just about being efficient for the sake of efficiency, it's about using all this connected data to deliver smarter, faster, and genuinely better care to patients.
And the impact here is very real. You can see it right here. When doctors and nurses have instant access to a complete picture of your health, they can make decisions faster and more accurately. As you can see, this directly leads to fewer medical errors and way less waiting time for you. These aren't just abstract ideas, they are real, tangible improvements to the quality of your care.
And you know, a fully integrated system is really the launch pad for the future of healthcare. Think about it. Telemedicine appointments where your doctor has your entire health history at their fingertips, or automated alerts that warn a doctor about a potential drug allergy before they prescribe something. Hospitals can even analyze all this data to spot bottlenecks and make their own operations better. All of this innovation is powered by connected data.
So if there's one thing to take away from all this, it's that healthcare integration isn't really just about the tech. It's about making all the complicated, moving parts of a hospital work together as one team, with the patient right at the center of a safer and smarter system.
And that leaves us with one last big thought to chew on. We've seen how powerful and life-changing connected data can be. So the next big question we all have to ask is, how do we make sure this information is always used wisely, ethically, and only for the good of the patient? That's the challenge for all of us going forward.